Kids Guide to Cancer app is a valuable tool for parents and grandparents and anybody in a child's community to talk to children about cancer, whether it be about their diagnosis, the diagnosis of a sibling, or a parent or carer. It's age appropriate, it's educational, and it's available now in 4 additional languages, and it's also available as a website as well as an app. We have translated the website, the app, the animated videos and the promotional assets into 4 languages. These languages are Arabic, Hindi, Cantonese and Mandarin, and we chose those languages because outside of English they are some of the most spoken languages within Australia and also represent our Camp Quality community. We've decided to launch a website and app targeted to CALD communities because at the moment Camp Quality helps 1 in 3 children diagnosed with cancer, and we eventually hope to help them all. We know that families from non-English speaking backgrounds have difficulty finding age-appropriate, credible educational material about cancer, and the app certainly provides that. We also know that these families have poorer health outcomes as a result of not being able to get the information that they need in order to inform their decisions. So we're trying to address this gap, and I think the Kids Guide to Cancer app and website does that. Meeting the needs of the CALD community or communities that speak Hindu, Arabic, Cantonese or Mandarin, as well as English-speaking communities, is really important. And the way that we're doing this is through a number of communication channels, including social media tiles and posters. It's important that these communities know that we're meeting their needs and that we're providing this credible information for them in their own language. So what we did was we spoke with specialists in the area to make sure that we had the language right, we had the information right, and that we are also culturally appropriate. So with the Kids Guide to Cancer, now families can actually get that information that they need and talk to their children about cancer by using the app or the website. What's important to note is that the Kids Guide to Cancer website and app is for parents who often don't speak English, as well as their children who are learning it at school. They can talk to their kids in their own language about cancer. The app really is a guide for parents or carers to take the child through what is happening to them or what is happening to the child or their siblings. And that's really important. It's not that the children themselves are necessarily going to read it. It's really so that the whole family can have one central point of credible information and education. One of the important things to note here is that often the children can speak English, but the parents can't. So the website and app allow the parents to talk to their children in their language and to understand the kind of information that a child might want to know in this age-appropriate way. There's animated videos, it's all done from the child's perspective, but it allows the parents to have that conversation. It's really important for us to get the word out there that this tool exists, that there is something there for those diverse language groups to be able to talk about cancer, because we know cancer happens to so many families. Our next iteration is really to expand the app to include other languages and other communities so that we're able to help as many people as we can get through their darkest days, because a cancer diagnosis is incredibly scary and you do need the right information at your fingertips. You can download the app from the Apple Store or Google Play for free, or visit campquality.org.au/Kids Guide to Cancer.
Hi everyone, my name is Dr. Luciano Dalla-Pozza. I'm the Director of the Cancer Centre for Children at the Children's Hospital at Westmead. What I do is look after young people with all forms of cancer, and I head a team of very talented doctors and nurses and allied health staff that look after the very complex needs of young children and their families. Treatment duration for children with cancer can vary from 3 to 6 months to out to 3 or 4 years. And the treatments have to be changed or tailored to the type of cancer and how aggressive it is. And these treatments, although they're extremely effective, they take a toll on the child and their family. And after we finish treatment, we have to follow them to make sure the cancer doesn't come back and to see if we've caused any problems that might arise later in life. We take a treatment and deliver it over a long period of time, and that period of time means that we disrupt the child's social life, their education, we disrupt the family life so that they have to put everything on hold. Children's understanding of cancer is, to a large part, dependent on their age. And once they get beyond 7 or 8 years, perhaps even earlier, they recognise that the illness is serious, and our job is in fact to neutralise that fear, take it away, and make them recognise that the approach, particularly in Australia, is a very positive one. We expect to cure children, and that's the approach we take. How they respond to the diagnosis, to some extent, also depends on how the immediate family reacts. And so packaging care for a child with cancer involves packaging care for the family and making sure that they have the strength and resilience to show the confidence that this is a temporary thing and that their normal life will resume after a period of time. At Westmead Children's Hospital, about 60 to 65% of our patients come from a multicultural community, and they have their own special challenges, particularly when we try to explain to them the nuances of treatment, and it's very complex treatment, and making sure that they understand exactly what the journey might look like, the potential complications, is extremely important. A lot more can be done. Delivering them 10 minutes of information is only just a small fraction of the 2 or 3 years of therapy that they endure. And that journey is unpredictable and littered with unexpected complications, which have to be explained and interpreted appropriately, and always with a decent dose of hope and expectation. Because what we find is knowledge is incredibly powerful to families, and if they feel they're in control, they're far more likely to adhere to the very rigorous demands of treatment and follow-up. The Camp Quality Translated Kids Guide to Cancer will help families and the patients, and when I talk about family, I mean the extended families. I mean aunts and uncles and grandparents. But importantly, if you look at that particular guide, it's also very age-appropriate language. Having a child with cancer is a family affair. And so there's a contribution that each member of the family makes to the knowledge and well-being of that child. And if they can understand the processes, if they can understand the treatments, if they can understand the risks and the expectation of cure, they can convey that information to the child. If the information flows to that child that's clear and concise, that child will develop confidence that everything will be fine and everything will be okay.
Ben， 我今年11岁，我和我妈妈、我奶奶和我妹把她送去了城里的一家儿童医院。最开始我挺生气的，学校的他教我怎么在压力大的时候冷静下来。后有一个用来输药的端口，而且我剃了光头，就是为了像他一样